This is Professor Emily Mercuri, and we are covering Chapter 5, Abbreviations and Systems of Measurement, in the text Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives for Chapter 5. Upon completion of this chapter, the learner should be able to 1. Identify common abbreviations and symbols used for medication orders. 2. List the 6 parts of a medication order and the 2 additional items required as part of a prescription. 3. Describe the responsibilities of a healthcare professional regarding verbal and telephone orders for medications. 4. Interpret medication orders correctly. 5. Define the 3 systems of measurement. 6. Convert dosages between and within systems of measurement. And 7. Describe appropriate patient education for those who will be measuring and administering their own medications. All right, we're going to talk about medical abbreviations, and interpreting medication orders is a form of written communication that's very important to healthcare providers. It's assumed that you are going to have knowledge of abbreviations and symbols that are used in medical communication, and we want to make sure that we are accurately interpreting what the physician is writing as part of the order. So if you ever come across one that you don't know and you are going to give a medication, make sure that you stop, you look it up, you talk to somebody. We always want to make sure that we're accurately interpreting because, as we know, medication errors can have serious consequences for patients. So in this table below, it gives you a really great overview of some common ones. One of them being the abbreviation A, meaning before. You're not often going to see A by itself, but you will see it in conjunction with another letter. For example, AC means before meal. Remember that most of what we do in medicine comes from Latin roots, and so C is not the first letter of the word meal, but it is the first letter of the word meal in Latin. So sometimes you just kind of have to remember those and not get too hung up on the English version. So AC, before meal. AD means right ear. AS means left ear. Again, those are ones that you may not see as commonly, but the D and the S are going to come from the Latin words, not the English words. BID is one you will see a lot, and that means twice a day. B for bi, BI, the short term of that is 2. So BID, twice a day. CAP is short for capsule, which is a form of medication. Sometimes medications can come in pills or they can come in capsules, which is the kind of the gelatin casing around the actual medication itself, which may be in a powder form. So CAP is abbreviation for capsule. DC or D/C means discontinue. So if you see DC, it means we're going to stop that order. So you might see this something like the physician says to DC the metformin. The physician wants you to discontinue that medication, stop giving that to the patient. And it oftentimes will have something like DC this medication at this time. So it has a more clear, we're using it up until now and then we're going to stop. MEQ, lowercase m, capital E, lower q, is milliequivalent, and that has to do with a measurement. MG, lowercase m, lowercase g, is milligram. ML, lowercase m, lowercase l, or just to be confusing, lowercase m, capital L also works, and that is milliliter. MM, lowercase m, millimeter. So these are all metric units of measurement, and metric is what we use most of the time in healthcare, which is what most of the world uses for all measurement, but the imperial system that we use in America is very different. So most of the time we will be using metric. And that's great because metric is units of 10. It's a little easier to interpret. NPO is nothing by mouth. Comes from the Latin nil per oris, nothing by mouth. Oris is mouth. Nil is none. Per is by. So NPO, nothing by mouth. OD, right eye. OS, left eye. I will say those and the ear abbreviations I've never seen used in practice, so those are less commonly used in current medical practice. IM means intramuscular, and that means that the medication is going to be given in the muscle as an injection, as a shot. IV, intravenous, means the medication is going to be given in the vein through an intravenous line that is placed by the RN or the physician sometimes. The abbreviation HS is bedtime, and you can think of it as hour of sleep. So the hour of sleep, the time they're going to bed, this medication is to be given HS, hour of sleep. Usually those are medications that will make the patient more tired and that are being used to help with sleep. PO, per oris, by mouth, means that the medication is given by mouth. So if I'm giving metformin PO, it's going to be swallowed. It's going to be in some kind of pill or capsule format. GTT means drop. We used to use GTT and calculate, and still in some rural areas they'll do this, but they would calculate how many drips came down in the little IV chamber when they were hanging IV medications. Now we have machines that we program that give us the rate and control the rate, versus before they would have to literally do the calculation and see how many drops were coming down in the chamber every minute. SUPP is suppository. A suppository goes in the rectum, and it is very quickly absorbed. That's a good kind of medication for certain things that need to be rapidly acting, or if the patient cannot take anything by mouth. QID means 4 times a day. QH means every hour. SC is subcutaneous, and that is a small needle that goes just right under the skin. Certain medications are given that way. SL, sublingual, goes under the tongue. SR is sustained release. That medication is designed to release its contents over time and give a more steady and long-lasting effect. TID is 3 times a day. And TSP, or lowercase t, is teaspoon. That's a lot, and if you are just listening to this and not looking at the slide, you probably just heard me say a bunch of letters and it was a little bit uninteresting to you. So I highly recommend pulling up the slide. This is slide 3, and looking at that chart. It is also in your book. You should be kind of familiarizing yourself with them. You don't need to memorize all of them, but you should know some of the big ones that I pointed out. As healthcare professionals, we need to be aware that there is also a do not use abbreviation list. These abbreviations have been recognized by the Joint Commission as being problematic due to misinterpretation and should not be utilized when communicating verbal or telephone prescriptions, labels for drug storage bins, medication administration records, and pharmacy and prescriber computer order entry programs. A few examples from the do not use list: BT for bedtime. It can be mistaken as BID, which means twice daily, so we will use the word bedtime instead. Per os used to mean by mouth or orally. It's misinterpreted often with the OS as that abbreviation for left eye, so we use PO, by mouth or orally. Q1D, intended meaning daily, misinterpreted as QID, which, as we learned on the last slide, means 4 times daily. Instead, now they will write daily. And then, interestingly enough, they put as part of the do not use list QHS, nightly at bedtime, mistaken as QHR, or every hour. It says to use nightly instead, but they also put HS, intended to mean half strength, but mistaken as bedtime or per hour of sleep. They did put that on the last slide as an abbreviation, but it is being phased out. It has been added to this do not use abbreviation list. So instead, we are going to use at bedtime, if that's what we mean, or half strength, if that's what we mean. So just be aware that even though it's on the last slide, it is going to be added to this do not use abbreviation list. And typically, we are just going to write what we mean. When receiving a medication order, there are 6 parts that must be in the order. So the date and time of the order, especially if you're taking the order over the phone or verbally from a provider, the patient's name, the medication's name, the dosage or amount of the medication, the route or manner of administration, and directions for use, including the time to be administered and or the frequency. So these are your 6 parts of a medication order. In addition to the 6 requirements, all medication orders must include the Drug Enforcement Administration, DEA, number of the prescribing healthcare professional and proper refill information. So why is this important? This means that if a provider is writing a prescription, it has to have all 6 parts of this, and it has to have their number that is uniquely assigned to them so that it is an accurate order and it can be checked against their number, making sure that no one is illegally ordering medications under this number. Sometimes physicians will call in verbal orders, and when this occurs, it's the responsibility of the health professional receiving the order to obtain the name of the person calling the order in, write it down, and read it back for verification. To avoid delay in patient care, the physician will sign the order upon receipt at a later time. Usually what this looks like is a provider, let's say I'm working in the ER and my patient is going to be admitted up to the ICU, and the intensivist, the ICU doctor, is not physically in the ER. He might call and say, hey, I noticed that they need blood pressure medication. Can you put in the order for me? Typically, we avoid this as much as possible, but there are cases where it's urgent, it's time sensitive, the provider's not at a computer, in which case we need to make sure we get all of that information. Okay, I can put that order in for you. What is the patient's name? Let's make sure we're talking about the same patient. Which medication do you want ordered? How much of that medication? How many mLs? How many milligrams? And do you want that given via IV, via intramuscular shot, orally? All those things need to be there. And then directions for use. Is this a one-time order, or are we giving it every 4 hours, every 5 hours? So we want to make sure that we have all of that information, as well as the prescribing doctor's name. And then if it's a prescription sent to a pharmacy, it also needs to have that DEA number, especially for controlled medications. When you're taking a telephone order, it's important to repeat all of the drug information back to the physician to ensure that you have the proper order. In addition, after the order's been called in, proper documentation such as the time, date, and name of the individual taking the order should be properly documented. This is extremely important to avoid medication errors and legal complications. You also want to make sure that the person taking the order, that it's within their scope of practice to take a telephone order. Typically that includes nurses, medical assistants, both RNs and LVNs under the scope of nurses. Sometimes physician assistants, nurse practitioners, that kind of thing, although those people can also prescribe. CNAs or techs or caregivers are not able to take telephone orders. It's not within their scope of practice. And it could also vary based on facility what their policies are. Some forms of digital medication order submission. There's such a thing as a computerized physician order entry, CPOE, and that's the implementation of computerized medical records that allows medication orders to be sent digitally. In inpatient settings, there is something called e-prescribing, ERX, which allows for prescriptions to be ordered through the patient's electronic health record and sent directly to the pharmacy. And then there's also the EMAR, Electronic Medication Administration Record. And this is how administered medications are recorded in the patient's health record. Ultimately, it's the physician's responsibility to ensure that all the orders are complete and have the required components, and to address any missing information or discrepancies. So in the EMAR, if there is a physician order in there, it needs to tell me all of those things in terms of when it's given, how much is given, how often, what's the name. It needs to be within the correct patient's chart. And the pharmacy also sees that when that order goes in, and they are responsible to double check and verify that. But the nurse is kind of the last person who takes a look at it before they give the medication and make sure that it is all correct. The nurse sometimes, as I've been talking about, also is the one putting in the order for the physician, but the pharmacy will block it if you miss any component of those 6 things. If it's not properly written, they'll just say, hey, this doesn't tell us how often it needs to be given, or it doesn't give us a dose. So it has to have all of those 6 elements. To reduce medication errors due to misinterpretation, cautionary measures such as making sure you're printing legibly or writing the name of the medication and prescribing the quantity of the medication in both textual and numeric formats should be taken, and the prescriber's name must be typed or written below the signature. What this is saying is if you are using a non-electronic record, you need to make sure that the printing is very legible, that it's clear exactly what is being ordered, and says both textual and numeric formats. So it might say QID and then in parentheses the number 4 times a day, something like that, so it's written both ways. I will say this is less common in current practice. We are typically more likely to use electronic records. On this slide, there is an image illustrating a prescription blank, so if this was on a notepad or being written up, we want to check this for completeness, legibility, and accuracy, including the date, patient's name, medication name, dosage, route, frequency, number of refills, and the DEA number for controlled substances. Prescriptions may be printed, phoned, faxed, or sent electronically to the pharmacy. So the name on this one is Jane Dosage, so we've checked that one. We have the name. The address, which is not part of our 6 checks, but important to know where we're sending this to. We have the name of the drug, Polymox. We have the dosage, 500 milligrams. We have the frequency or time, 1 PO/TID, so 1 of these capsules by mouth 3 times a day. We have the number of refills, dispense 30 pills per each time they fill it, with 3 refills. And then we have the physician's DEA name, which is on the bottom of the prescription here, right underneath the provider's name. And so you have all 6 elements here on this medication order, so that one is complete. All right, knowledge check activity. Which abbreviation best represents an order to administer medication 4 times per day? A, QD, B, TID, C, BID, D, QID. The answer is D, QID. Knowledge check. There are 6 required parts that must be included in a medication order: date/time of order, patient name, medication name, dosage/amount of medication, route/manner of administration, and directions for use/frequency. What is another part that must be included? A, age of patient, B, refill information, C, patient weight, D, patient address. And the answer is B, refill information. Knowledge check. Which is not a responsibility of the healthcare professional regarding telephone and verbal medication orders? A, write orders down as soon as they are given. B, have the physician sign the orders immediately. C, read back the orders for confirmation. D, obtain the name of the person calling the order in. The answer is B, have the physician sign the orders immediately. So it is not a responsibility to have the physician sign the orders immediately. The physician will sign the order after it's filled to avoid delaying treatment of the patient. Knowledge check. Which indicates the first responsibility of a healthcare professional when preparing the medication orders? A, knowledge of medical terminology. B, gaining insurance information. C, interpretation of medication orders. Or D, ability to read the physician signature. The answer is C, interpretation of medication orders. So it is your responsibility as a healthcare professional that when you're preparing a medication order, you are correctly interpreting that order. I touched on this briefly, but when we are going through this course, I want you to get yourself really familiar with the metric system. So there are 3 systems of measurement listed on this slide. The first is the apothecary system, and you don't need to know about that other than that it's become obsolete. So an apothecary is known as a pharmacist or druggist. This was this original measurement system that utilized weight for writing medication orders. It's no longer used currently, but you may hear the term as something that was used in the past as a precursor to current systems. The metric system is the preferred system of measurement, which is used in the present time. Again, most of the world uses this for pretty much everything, including medicine. Here in the United States, we use it largely for the medical profession, but we also use the imperial system, which means we measure in things like feet and inches instead of meters and centimeters. But we are one of the only countries in the world who does that. So when it comes to the medical system, we are going to be using almost entirely the metric system. The metric system is based on powers of 10. So milli, for example, represents 1/1000th, or multiplying by 0.001, simply moving the decimal point 3 places to the right to convert to grams. So if you had 1,000 milligrams, you're going to move the decimal point, and that equals 1 gram. The metric system is based on 3 basic units of measurement: liter, capital L, for volume, meter, lowercase m, for length, and gram, lowercase g, for weight. We also have the household system, which is the least accurate. When having to convert from metric to household, make sure that you're using a conversion table or a pharmacist to avoid dangerous errors. Sometimes this is used in a home setting, but it has access to the few basic equivalents commonly used, but it's not, again, going to be accurate in the way that the metric system is going to be accurate. So an example of a household system would be give 1 teaspoon of medication, but a teaspoon is 5 mLs. So it would be more accurate to use the metric system and say 5 mLs to ensure that there's consistency in size versus someone says, well, this is my smallest spoon, it must be a teaspoon, if that makes sense. So we want to make sure that we're always going with the most accurate system. The following simple system can be used to convert between different units of measurement, which are conversions that you will need for drug dosage. So it's a great little chart down here on this slide. Each box represents a power of 10, and you simply move the decimal to the number of places and directions starting with your given unit. So for example, if you have 500,000 micrograms, you'll see micros are all the way here on the right side of this little chart. And you want to know how many milligrams that is, you will move the decimal point over to the box where it says milli, which is 3 boxes to the left of micro. So by moving that decimal, you know that 500,000 micrograms equals 500 milligrams. Then if you were converting that to liters, you would move again 1, 2, 3 boxes to the left, and 500,000 micrograms equals 500 milligrams equals 0.5 liters. So I like this little representation because it gives you all of these prefixes and lets you know which direction you need to move and by how much to get the equivalent of that. This slide has an example of a common medical dose conversion. And I want you to pull up this slide and I want you to look at the way that they're setting the equation up, because this is something you'll need to familiarize yourself with. I do have a bunch of examples in the math section of the course. There's a separate module, and so that can give you some opportunity to practice and to read through the way that we're setting up the equations. So this one says a patient weighs 170 pounds and is ordered a drug dosage of 10 milligrams per kilogram. You need to calculate how much drug they should receive. You need to change the pounds to kilograms. So what you want to do is you want to write the given weight over the denominator of 1. So anytime you put a number over 1, it is going to equal the same thing, right? You're just dividing it by 1. 10 divided by 1 is 10. It's just kind of giving you the same exact thing. You just put it over a denominator. So you'll write 170 pounds on the top and then over 1. Then you want to place the unit that you want to cancel in the denominator of the next number, and the unit you want to convert to in the numerator or the top part of the second fraction. So in this case, 170 pounds over 1 is your first fraction. Multiply by 1 kilogram over 2.2 pounds, because 1 kilogram equals 2.2 pounds. So you're essentially setting up your equation that everything will equal out because you've put your first number over 1, and the second fraction right there, that equals 1 as well. So when you put something in the numerator of one fraction in terms of the unit of measurement, and then the same unit of measurement in the denominator or the bottom of the fraction on the second fraction, you can cross cancel those out. So as long as one's on the top and one's on the bottom, you can cancel out the units. So what you end up getting is 170 pounds over 1 times 1 kilogram over 2.2 pounds. The pounds cancel out, and you get an answer of 77.27 kilograms. Now this last sentence, again, because I did not create these slides, they were created by the company, they have a typo, but I will read through this. Your dose reads 10 milligrams per kilogram. This patient should receive 10 times 77.27, this is where their typo is, or 772.7 milligrams of the prescribed medication. You may need to round depending on the medication units available. Typically, this would probably get rounded to the nearest maybe 5 milligrams, so 730 milligrams, for example. Knowledge check. When converting pounds to kilograms, you would divide by A, 2.2, B, 10, C, 0.001, D, 3.2. And the answer is A, 2.2. Knowledge check. Within the metric system, a prefix representing the power of blank can be placed before each basic unit to change its value. A, 20, B, 10, C, 15, D, 5. And remember, the answer is B, 10. The metric system uses increments of 10 and prefixes for each increment of 10. Now, I've talked a lot about medication administration where the healthcare provider is giving the medication to the patient. But what about when the patient is going to self-administer? So they are doing this at home, they're giving this medication to themselves at home. There's critical education that needs to be provided to the patient to ensure that they can safely administer a medication at home. This includes clearly written instructions for the patient, instructions to any family members that may be assisting, clearly marked measuring spoons and cups for household measurements. Again, we try to avoid that, but if they are taking a medication and they are using home devices, we want to make sure that they're using things that are marked. Advise patients not to use tableware such as teaspoons, tablespoons, teacups, or drinking glasses due to inaccurate measurement. For example, the average drinking cup is around 8 ounces, but we are not going to be using an average drinking cup. We are going to be using a cup marked clearly with the mLs. So our medication wouldn't be in ounces in the first place, and it would also not be in your, quote, average drinking cup because there's no markings on that cup. We also want to always speak directly to the patient to ensure comprehension and make sure they repeat the instructions. We call that teach back. So for example, your baby has a fever, you are going to give 5 mLs of Tylenol every 6 hours as needed. And then you're going to have them repeat that back, make sure they understand what 5 mLs is. You can show them on the measurement device that you give, you can show them the mark that is at, make sure that they're understanding and they can repeat back to you what the instructions are. Knowledge check. Which would be a proper measurement tool for a patient to self-administer 1 teaspoon of cough medicine at home? A, serving spoon, B, tablespoon, C, measuring spoon, D, unmarked medicine bottle cap. And the answer is C, measuring spoon. Your self-assessment for this chapter: how many abbreviations and meanings can you remember from those presented in the chapter? I highly recommend that you pull out your textbook and that you look through it, because I covered some that were in the table, not all, and there are many, many more abbreviations to learn. Go ahead and familiarize yourself with those. Make flashcards if you need to. 2, what are the 6 parts of a medication order? And then 3, identify an abbreviation from the do not use list and an appropriate alternative that could be used in a verbal or telephone medication order. Thanks for listening. This has been Chapter 5 of Essentials of Pharmacology for Health Professions, 9th edition.